Hi, everybody. This is Dr. Eliana Aaron from EmoCare, and today is March 24th, and I'm here for the Q&A. Going to start off with a good deed. I was asked by the school if they have the opportunity with the current restrictions, and the restrictions have changed. You're not allowed to leave your house unless it's for food or medicine. There's no more wandering around the neighborhood. So the question is, they're in the old city. There are needy elderly people in the old city. Can we send our students to deliver food and medicine to them? And this is what we were given, is that these people can't leave their homes because of their age, which is a very significant problem. And obviously we want to do some drop-offs and understand that when you think about the people who are critical currently in our situation, it's not just the medical people. The people who are bringing food to the elderly, to the needy, to the ill, are people who are doing services to help support the weaker parts of our community. So these are essential services, and they absolutely will remain essential services. So being able to do this means that we are going to be taking care of our elderly. There are some restrictions because we have to keep people safe. Number one is that if someone themselves is not feeling well or is in quarantine, but definitely even if you have a sniffle, you can't do it. You have to stay home. We're not taking chances with this very frail population. Remember, they have the highest mortality rate. Number two is that when the students are doing this, they should do it in groups of one, meaning no groups. Everyone's doing it individually, staying apart from each other in public, picking up the groceries outside. We don't want people going into grocery stores unless it's for themselves. So if the food is all packed up, that would be the best. It could be left out. You pick it up, you take it to the older person's home, you knock or ring, and you leave it outside their door. You could stand 2 meters away and talk to them, but you cannot enter their home or go near them. Unfortunately, that's how it is, but they'll be very grateful that you did this. Same thing with medication. Medication should be ready to go, picked up, brought to their house, knock on the door, stand 2 meters away, and give it to them. And they'll be so very grateful that you're doing that because you're sustaining them. I would personally wear gloves when doing this. If you're not going to be near other people, there's no reason to wear a mask. If you might be near other people, you can wear a mask. But I think that's it's kind of important to keep in mind, just making sure that you're being careful and protecting yourself, but at the same time, this is a really good opportunity for a good deed and for chesed. Going into masks, if students are still allowed to go to the grocery store, should we require masks and gloves? So there's mixed reports about this. I would definitely, when someone's going to the supermarket, what I get concerned about the most is, the shopping cart that you're holding that 1,000 people held before you. It's recommended now to disinfect that. Actually, that's now come out as well. So I tell people to bring, a little bag that has a bleach soaked, paper towel, and just wipe it down. I also suggest gloves. The gloves have to be used carefully. Wearing gloves incorrectly may give you a false sense of security. So if you have gloves on and then you touch your phone and then you touch your face and then you touch, produce that could have, you could be giving them something, they could be giving you something, whatever, then you're not using the gloves correctly. Gloves should be used for the purpose of touching things that are not you. And when you're done shopping, they need to come off before you touch your phone, your face, or anything else that belongs to you or is on your body. And when the gloves come off, your hands should be cleaned with alcohol or soap and water. And like I said, I recommend that packages that went through we don't know how many hands Also be sanitized when you get home. Do you need to wear a mask? If there's a chance that you're going to be near people, then it's not a bad idea. It creates social distancing. When you wear a mask, it doesn't block out, the normal surgical mask does not block out virus. What it does is it contains your own personal exhaled respiratory droplets into the mask for the most part, which means that you at least will not be sharing your germs with other people. But when people see you wearing the mask, they stay away from you. You know, they sort of instinctively say, well, this person might be sick. And so it actually helps to keep people away from each other, which is what we want. So it's not a bad idea, but not necessarily required unless you're going to really end up being too close to people. Stores are not supposed to let more than a certain number of people enter. I believe it's 4 people for each cashier, and everyone has to stand 2 meters apart. So it is quite restricted. But not every store is holding to this, even though it's the law. And so you have to be careful when you're looking into a makolet. If you see there are people in there, and these makolets are really small, don't go in. Wait. I went to a pharmacy a few days ago. I was the only one in the pharmacy, and everyone else was waiting outside 2 meters apart. It was very impressive, actually. And I'm glad to see that that people are taking it seriously, and it makes me feel more secure. As far as masks go, someone was asking about the N95, the NK95, and the regular surgical mask. So first of all, let's get one thing straight. The NK95 is a complete lie. They're trying to pretend they're N95s. They're charging a lot of money, and they are absolutely not approved for any kind of medical use, and they're not approved as a way to block out virus. So basically, it's giving you the same protection as a surgical mask that you could buy for a lot less money, that you tie behind your ears or you tie behind your back, your neck, your head. And they're just charging more to fool people into thinking it's the same thing. It's not the same thing, okay? And this was actually going on, and they're trying to track down, you know, the people who are doing this. The actual N95 masks are medical grade masks. So those have been approved by the Ministry of Health, by the CDC, by the World Health Organization, by I think pretty much every Ministry of Health or Department of Health in the world, because they have been proven to block out a very high percentage of virus and bacteria. And it has, here's the problem with the N95, okay? So N95 mask, and it's a very expensive mask, okay? It's on a good day when it's not a pandemic, it's, you know, $7, $8 a mask. These masks are supposed to be fitted to your face professionally. They have to be fitted to your face every time you put them on. So you have to, so they are reserved for medical providers. Okay, my brother-in-law is an oral surgeon. He had a N95 on his face for 5 hours while he was taking care of patients, and he ended up with a sore on his nose because it is a very tight fit. He's going to be okay, but it's not for the layman. And the reason why is because if you don't fit it exactly correctly, what happens is the virus gets in through the pore ceiling. Okay, and if you don't do it correctly, that's what happens. The virus gets in, and now the virus is inside the mask on the sterile side, and you're just breathing it in, and it can't escape because it's, you know, it's closed. So you end up in situations where if you don't wear it correctly, you could end up getting really sick. You could end up getting it worse than if you just had a surgical mask on. So my recommendation is if you're wearing a mask, it should be a surgical mask. Please leave the N95s for the medical personnel who, first of all, know how to wear them. And second of all, there are shortages right now, and we really need the medical personnel to have them. That's extremely important. Another quick question. What are the chances of catching the virus from a taxi driver or someone who's driving while you're in the back seat? Assuming we disinfect the seats, what else can be done to minimize the chances of infection? That's a good question. They're shutting down public transportation. That's what's in the news right now. They are going to let taxis keep working. So right now the restriction is two people in a car unless they're from the same family. So first of all, knowing who's in the car with you is very important. So if you're in a taxi, you don't know where the taxi driver has been. Um, so sitting opposite him in the back is the furthest you're going to get. It's not 2 meters, but it's the furthest you're going to get. It's a good idea when going into places where you don't have, you're not in your home, you don't have control over who touched what and everything. It's not a bad idea to have gloves on. It may not be a bad idea to have a mask on. There's no evidence to say you must wear a mask, but certainly gloves make sense to me. I don't think you need a mask. I think you probably need the windows open. Having windows open means there's a very fast exchange of air so that anything that's kind of going your way is also leaving your way. And that's recommended, for example, when someone's landing in Israel and they have to go straight into quarantine, it's recommended that they get picked up in a private car. The driver should be with a surgical mask and gloves. The person coming out of the airport gets a surgical mask and gloves, sits in the back seat with all the windows open, and then they go straight into quarantine. So this is basically maintaining that idea because now you're in close proximity with someone who's not your relative. If it's someone obviously that you're related to, your father's driving you, your brother, whoever, your sister, it doesn't matter because you live together in the same household, so no restrictions are needed. So I'm going to probably continue these questions tomorrow because I have a lot more, trying to come up with the most pertinent ones. We should have a good update in the morning. I wish everybody good health, take care of yourselves, take care of your loved ones, and I'll be back.